Good afternoon. My name is Anna Paula Liston. Welcome to my FPX 4010 class assignment 1, collaboration and reflection video. During this video, I plan to reflect on interdisciplinary collaboration experience that I had in some way I was successful and unsuccessful outcomes. Identify how poor collaboration can result in inefficient management of human and financial resources. Identify best practice leadership strategies from the literature which the management and the Villa Health scenario could have used to improve their team interdisciplinary approach to achieve better goals. Identify the best practice interdisciplinary collaboration strategies to help the team in Villa Health scenario work more effectively together. Collaboration, leadership, and reflection. Some ways and strategies can be implemented to manage human and financial resources in healthcare organizations. The first one involves the creation of the Human Resource Department or Human Resource Manager assigned to cater to the requirements of the employees. It is one of the tactics that may utilize managing human and financial resources in firms. Employee selection and training, salary, and position allocations were the among the responsibilities. Leadership is also quite important in this implementation. To endorse effective management in one organization, finances and reduce the probability of the interceptions, manager staff and other leaders in the organizations must have a straightforward comprehension of the process related to employee shortlist, according to the article by Maria Panadar, written in 2019. Other strategies including employee process coaching, the salary made available to employees at various different levels. Other strategies for implementation that might apply include effective budget and allocating funding, financial funding, and resource depending of the value and profitability to the organization, as discussed in the article written in 2018 by Shea. Poor collaboration can divert resources to initiatives that are not vital to the organization existence and develop of insufficient resource to sensitive projects. Poor cooperation has also been linked to lower employee engagement, effectiveness, and innovation, resulting in financial losses, great employment retention, and poor broad organization performance. Like in Villa Health, the poor collaboration, the effect on human and financial resource. The collaboration of the Villa Health falling apart at the corporation by mandating the implementing a new EMR, electronic medical records, that was designated more for a hospital than a skilled nursing facility. Then sending in one implementation coach that wasn't familiar to the policy, the facility, and the daily workflow of the staff. Corporate managed to set a very poor success for the Villa Health, which is the new implementation of this EMR. If Villa Health instead allow Administrator Silva to designate the manager Chad and couple floor nurses, staff, or skilled nursing facilities to find the system that best fit the workflow of the facility need, there will be effective collaboration and best practice leadership. Instead to sending a stranger from their office to assist the staff during the rollout. That was my example in poor collaboration can result in inefficient management of human and financial resource due to unnecessary stranger to be getting paid overtime pre and during the rollout of this implementation, while this individual was not familiar with the daily workflow. The best practice interdisciplinary collaboration strategies to help a team of Villa Health scenario work more effectively together by my experience being a EMR consultant. We'll be adding extra staff, continued mandatory training depends on your job description, Due to EMR has many different sections. A full month on the rollout, have the consultants on the floor to help with the tricks and glitches the computers will present. Have food and drinks available for all the staff to compensate the new workload till the EMR gets familiar. Thanks to the interdisciplinary collaboration, patients receive comprehensive care that covers all their requirements. It increases patient safety by ensuring clear communication between patients and healthcare professionals, developing appropriate treatment teams, and establish treatment objectives. One example is a scenario in which I was managing a patient with several diagnoses. He was 50 years old who was amputated his leg following a nasty fall that got bilateral knees infected due to his arthritis. A nurse, a physician, a physiotherapist, a surgeon who had amputated his leg were all the care team members. The nurse's primary responsibility was to check his blood sugar and his blood pressure reading. The physician and the surgeon performed evaluations with the rest of the team to verify that the patient was recuperating appropriately. He learned how to walk using prostheses with the guidance of the physiotherapist. The team was also very active in ensuring the patient continued to take his medication, follow his leg care instruction, and did physiotherapy exercise. Sending later on for go to a continued stand care facility. Some of the great interdisciplinary corporations tactics that can be used to help a team include effective duty distribution based on credentials and setting common goals. Understanding and recognizing the shorts of contribution made by the team members and contributing the team debates. Making shared choices based on the negotiation, openness, trust, communication, and honoring each member's role in the group are all tactics that may be used. Partnership forming via long-term, mutually respect work connections are also crucial. A state by Shangaletti, written in 2017. Furthermore, constructive criticism may be utilized to assist team members in correcting their errors and working to improve the patient's health situation. It is impossible to avoid change. Change management theories may assist executives in identifying the areas of the company that require attention to enhance competitiveness and the business environment. Leadership tactics may be used to engage individuals in multidisciplinary teams to minimize resistance to the change that must be achieved, according to Loewen model, by article of Muldoon, written in 2020. Leadership tactics may also be beneficial in boosting membership commitment to change implementation, inspiring staff, and generating change related to actions. I described an article by Stoughton, Rosenbaum, and Creamer in 2018. Leaders can also utilize other techniques such as teaching, communicating, collaborating, incorporating, and coercing the staff to make the desired change. These Loewen model tactics might help to bring about constructive transformation. Reflection on interdisciplinary collaboration experience. Scenario: patient education, diabetes management. Creating a presentation for patients with diabetes, both type 1 and type 2, who attend to the Autoimmune and Lifestyle Disease Center was part of interprofessional teamwork experience. The purpose of this presentation was to describe the many types of diabetes, how to manifest, how they develop, and how to take care of the patients in managing this disease, and considerations that the patient should make throughout treatments. It also was designed to inform people about various healthcare practitioners' responsibilities in the meeting of this requirement. The comments that the different members of the interprofessional team incorporate the division of the task throughout the presentation, which include addressing the patient questions and doing follow-ups of the patients, were some of the presentation's accomplishments. Period management for certain interprofessional team members who took long time expected to convey their concepts to the patients, and a few arguments to emerge during the presentation preparation time were the areas of the weakness. Aside from that, owing to a shortage of time and requirement for the interdisciplinary team to begin all the clinical activities planned for the day, several of the patients' queries were not answered during the presentation. To promote time management, ensure that the member of the interprofessional team adhere to the time allotted for their presentation, allocating a few minutes after each presentation for answer all the questions asked, and providing patients with the opportunity to answer the concerns one-on-one with the team after the presentation. Thank you.